Hey everyone, and welcome to This Explainer. I am absolutely thrilled you're joining us today. Look, we're coming to you straight from the clinical perspective of the medical educators here at Westminster Multispecialty Clinic in Dubai Healthcare City. And today, we're going to tackle a topic that literally almost everyone deals with: those post-workout aches, unexpected tweaks, and lingering twinges. We're going to finally figure out what's just a normal part of being active and what actually needs a little bit more of your attention.
Okay, let's dive right into this. Here's our agenda for today. First, decoding your body's signals. Second, muscle cramps, normal or not. Third, we'll look at morning rust versus real stiffness. Fourth, when soreness overstays its welcome. Fifth, we're covering Dubai's active lifestyle risks. And finally, number 6, exactly when to seek expert help.
All right, section 1, decoding your body's signals. Is it just background noise?
You know the exact feeling. You wrap up a seriously tough workout and your legs just feel like lead. Or maybe your shoulder gives a little complaint when you reach for a high shelf. For most active folks, these sensations are basically just background noise, right? They're so familiar we barely even register them anymore. But every so often, something feels slightly different. And it leaves you wondering, wait, is this just how my body works, or is something actually wrong? I want to validate that internal monologue for you right now. At Westminster Multispecialty Clinic, our orthopedic team hears this exact question every single day from our active patients. It's a completely reasonable thing to wonder, because honestly, the line between normal and not normal isn't always super obvious.
A lot of what we see with our patients comes down to a very basic foundation: DOMS, or delayed onset muscle soreness. When you ask your muscles to do more than they're used to, you get these microscopic tears. Sounds scary, but your body responds by repairing them so they're slightly stronger than before. It's a built-in upgrade system. This symmetrical achiness, which usually peaks a day or two after your activity, is completely normal. It doesn't actually limit your day-to-day function, and it's totally safe to work through, or at least work around. It is not a warning signal. It's simply evidence that your body is adapting and getting stronger.
Moving on to section 2, muscle cramps, normal or not? Let's break down those sudden contractions.
Man, almost everyone knows that universally relatable and, let's be honest, intensely painful grip of a sudden muscle cramp. It always seems to seize up a calf or a foot at the worst possible moment, right? But in clinical practice, there's a really clear contrast we look for. On one hand, you have harmless cramps. Living in Dubai's climate, the intense heat and humidity, or even just sitting for hours in heavy AC that quietly dries you out, can really accelerate your fluid and salt loss. These benign cramps, they resolve nicely with some stretching, hydrating, and making sure you're getting enough sodium and magnesium. But on the other hand, we have warning sign cramps. These happen regularly during exercise with no obvious trigger, or they come with skin changes and swelling. When our specialists see these recurring in the exact same muscle group without a clear mechanical reason, it tells us there might be an underlying circulatory, neurological, or metabolic issue, and that requires a professional evaluation, not just more stretching at home.
Okay, section 3, morning rust versus real stiffness. Age, resting, and your joints.
So as active people hit their 30s and 40s, they often start noticing a bit of sluggishness in their joints, maybe some stiffness right after waking up or sitting at a desk for too long. How do we tell the difference between normal aging and something more serious? Well, the crucial distinction is this: morning rust lasts just 10 to 15 minutes and eases up quickly as soon as you get moving. It's just a normal factor of your tissues needing a warm-up. No big deal. But inflammatory stiffness is a totally different beast. If that stiffness takes over 30 minutes to ease, if it's consistently locked in the exact same joint, or if it comes with warmth, redness, or swelling, that's a signal. These specific signs point our team toward inflammatory joint conditions, and those benefit massively from early diagnosis and management.
I really want to hammer this point home. Joint pain isn't just an older age issue, and it is highly treatable in your 30s and 40s. At Westminster Multispecialty Clinic, our orthopedic consultants regularly see younger, fit patients who mistakenly blame their persistent joint stiffness on just being tired or, getting older. But once we identify that the underlying cause is actually something specific, it's incredibly treatable.
Section 4, when soreness overstays its welcome, moving from muscles to tendons.
Now we're entering the danger zone. What does it actually mean when that normal 3 to 4 day window of muscle soreness stretches into weeks? This transition can be super tricky. See, normal muscle soreness is diffuse. It's spread out across a whole muscle group and fades in a few days. But tendon pain, that points to a structural issue, and it's highly localized to one specific spot. And here is the really sneaky part that catches people off guard. Tendon pain often feels better during the workout as the tissue warms up. It totally tricks you into thinking you're fine, only to return with a vengeance after you cool down. That is a massive red flag for chronic irritation underneath.
The simple truth is tendon problems just don't behave like muscle soreness. Tendons are what connect your muscles to your bones, and they adapt so much slower to training loads than your muscles do. If you ignore this highly localized pain, say right in your knee, your heel, elbow, or shoulder, and just assume it's stubborn muscle fatigue, you are actively risking partial or even complete tears. And trust me, those require considerably more serious medical intervention than early stage management ever would have. Section 5. Dubai's active lifestyle risks. The danger of normalizing discomfort.
Let's shift our focus to the local scene and the unique behavioral challenges we see in our highly active patient population here. Dubai is an absolutely amazing fitness culture. I mean, we've got the early morning boot camps at Safa Park, dedicated cycling groups out at Al Qudra, paddle leagues literally everywhere, and a massive CrossFit community. It is a city that takes physical activity seriously, and that is fantastic, but there's a flip side. When everyone around you is training super hard and pushing through the pain, the real risk becomes normalizing genuine tissue distress. People just brush it off as part of the lifestyle. It takes deliberate self-awareness to recognize when you've crossed from a good, tough workout into actual injury territory. At the clinic, we know firsthand that catching these issues early, when conservative treatment works beautifully, is always better than trying to manage them once the damage is done.
Finally, Section 6. When to seek expert help. Stop self-managing and get assessed. Okay, this is where the rubber meets the road. What are the exact parameters for when you should stop guessing and actually come see our specialists? Well, our team put together this reliable, no-hype framework. You should absolutely seek our rehabilitation, physiotherapy, or orthopedic care if you hit any of these 4 points. First, the duration extends beyond 2 weeks without getting any better. Second, the location of the pain does not move. It is always right there in the exact same spot, especially near a joint. Third, it's having a real impact on your daily function or your sleep. And finally, number 4, the symptoms recur predictably every single time you do a specific activity. That strongly suggests a mechanical issue that simply will not fix itself.
I really want to pause here for a second and highlight something important. Our empowering philosophy at Westminster Multispecialty Clinic is this: listening is not the same as worrying. Paying attention to what your body is telling you doesn't mean you're a hypochondriac stressing over every little ache. Reframing a medical assessment as a smart, proactive choice instead of some scary last resort is the absolute best thing you can do for your longevity. Most sensations have a completely straightforward explanation and an equally straightforward solution.
Which leaves us with this final, vital question to think about. What is your body actually trying to say right now? We invite you to partner with the team at Westminster Multispecialty Clinic to get true clarity on your symptoms. Don't just guess. Getting clarity is always, always better than ignoring the warning signals. Reach out, talk to our team, and let us help you figure it out. Thank you so much for joining me for this explainer, and hey, stay healthy out there.